Universal healthcare in Canada sounds great in theory, but what happens when you actually need care? Imagine you or your child get sick during your first weeks in Canada. You have no family doctor, you have no health card, and you are completely lost. That's what happened to me. And if you're not prepared, this could happen to you too, and possibly at the worst time ever. No one tells where to go or what's covered. If you've just arrived in Canada or if you're seriously considering moving here, this video is for you. It's a practical, real-world guide for newcomers like us to navigate Canada's healthcare system. It's not a generic system overview, but what you actually need to know to get the healthcare as a newcomer. How to find help when you don't have a family doctor, how to get medications, what to do before your health card arrives, and how to simply avoid stress and confusion that many of us face when we first arrive, myself included. Everything in this video is based on my lived experience and the research that I wish somebody else had done for me when I first arrived. All the links and resources mentioned in this video will be in the description box down below. And feel free to pause this video at any point to take a screenshot or take any notes, and grab some coffee or tea because we have a lot to cover today. If you're new to my channel, hi, I'm Bella. I moved from China to Canada in 2019, been in Canada for about 6 years now. On this channel, I offer real-life insights and practical tips to help make things better for those seriously thinking about moving to Canada or just starting out here. So in this video, here are the things we're going to cover today. I'm sure at this point you already know that Canada offers universal healthcare to all residents, so I'm not going to bore you with any more information on that. Instead, I'm going to highlight the 4 facts that I found to be extremely important for you to understand before we get into the tips that are specifically tailored for new immigrants. Fact number 1. Under Canada's universal healthcare system, each province or territory makes their own health insurance plans, which leads to differences in coverage and services provided province to province. So the takeaway for our new immigrants here is that once you figure out which province you're going to live in, you need to go on their website and figure out what your province offers exactly in their healthcare plan. Fact number 2. As of 2025, an estimated 6.5 million Canadians don't have a family doctor, and that's about 1 in every 5 people. With adults aged 18 to 34 having the least access, only about 74% of this population have a family doctor. So the takeaway for you here is that there is a shortage of family doctors all across Canada. And that means once you arrive here, you'll likely have to wait for one, especially if you don't belong to the group that require urgent medical needs. Fact 3. There is a slight variation in the shortage of family doctors from province to province. And here's the latest data from 2022. As you can see, in 2022, fewer people in Ontario, Alberta, Manitoba, Saskatchewan have no access to family doctors. Obviously, the data has changed since 3 years ago, but this should give you a pretty good idea of how the situations were like from province to province. And maybe this would factor into your own decision when you're researching which province or which city you want to live in once you arrive. Fact number 4. Studies have shown that recent immigrants are almost half as likely to have a family doctor than established immigrants. That is, immigrants that have been in Canada for over 10 years or more. And one of the main reasons is that recent immigrants have no prior knowledge of the complex healthcare system or the role of family doctors in Canada. To me, that's not just a gap, but a huge risk. If you don't understand how the system works, you're very likely to miss out on the medical care that you and your family well deserve. But don't worry, in the rest of the video, I'm going to show you exactly what you need to know to make the healthcare system work for you. So first things first, how do you access Canada's universal healthcare? The simple answer is to apply for a health card, but it can get really tricky depending on your current status in Canada. And to make this process as painless as possible for you, I've gathered 3 tips that you need to pay attention to before you start your application. Tip number 1, make sure to check your eligibility in your province or territory. For example, if you're a temporary resident here in Canada without a work permit or a study permit, you're likely ineligible for a health card. In that case, you either have to pay out of your own pockets when you need medical care, or you can also look into private medical insurance providers. And we'll talk more about private insurance providers and health plans later in this video. Make sure you stick around. Or if you're a refugee claimant in Alberta or Quebec, you're not eligible for a health card. Instead, you must use the interim federal health program for your health coverage until your refugee claim is approved. Tip 2, make sure you have all the required documents. Usually, provinces are looking for 3 kinds of documents: residency documents, identity documents, and legal status documents. But I'm not going to get into too much detail about them because you can find the exact list that each province accepts on their own website. But essentially, what you want to prove through these documents is A, you are going to live in the province, B, you are who you say you are, and C, you do have the claimed legal status in Canada. Tip number 3, make sure to check the waiting period before you are covered by the public health insurance in your province. Some provinces have a 3-month waiting period before you're covered under the public health care plan, while others offer coverage upon your arrival. If there is a 3-month waiting period for your province, you might want to look into private health care insurance plan to cover your health needs during this period. To save you some time and energy, I've attached the health card application links for all 13 provinces and territories in the description box. So what happens after you've got your health card? Let's say if you're feeling unwell and want to check by doctor, what do you do next? To help you map out your next steps, you need to first understand the kind of role family doctors play in Canada's healthcare system. As mentioned before, not understanding the role of family doctors in Canada's healthcare system is one of the main reasons why new immigrants are less likely to actually get one. And don't worry, I'm aware that getting a family doctor in Canada is an issue in itself, so we will dive into the strategies for you when you don't have a family doctor later in this video, so make sure that you stick around. So, you can understand family doctor as your go-to person for any kind of health needs you have. And as your go-to person, here are some of the ways your family doctor is going to support you. First, point of contact. So your family doctor is the first person you go to when you have any kind of cold, fever, infections, you have questions about pregnancy, or you want to do some preventative checkups. They're the first person you call. So make an appointment with them anytime you need for any health concern. Second, your family doctor is also your care coordinator. They're going to help you navigate Canada's healthcare systems by, for example, referring you to specialists or ordering lab tests or imaging for you. For example, if you need a blood work done, they will have to order that for you first. Usually they will also interpret the lab test results for you next time when they see you and help you understand what your next steps could be. And they will also follow up on any hospital or ER visits you've had. Third, preventative care and monitoring. So they'll also keep you healthy over time. For example, they'll remind you of your annual physical exams, the immunizations you need, and maybe suggest you doing cancer screenings once every few years. They'll also help monitor your chronic illness if you have diabetes. Another good thing to know is that usually if you have a family doctor, that means your family does too, because they usually take on the whole family and provide care for patients of all ages, babies, adults, and seniors. They will also provide mental health support because they will screen you for any kind of mental disorders or depression, anxiety, and they'll provide talk therapy or refer you to psychologists or psychiatrists if needed. And last but not least, they also issue medical documentation for you when you need it. For example, if you need sick note for work, or if your kid needs a note for school, or if you need medical letters for immigration reasons, or you need referrals or prescriptions. So how do you get a family doctor? All you need to do is register with the province so that they will match you with a family doctor in your area. And once again, to make life easier, I've attached the links for all 13 provinces down below in the description box. All you need to do is find your province, click on the link, and start your registration. And before we move on, there's one more thing I'd like to address, because that's a question that I had when I was trying to look for a family doctor. So usually when you're being matched with a family doctor, it could be a family physician or a nurse practitioner. So this is when you would ask, Is there a difference? Which one is better? Should I be worried if I'm matched with a nurse practitioner instead of a family physician? From my own experience and the research I've done, basically, nurse practitioner can do 80% of what family physicians can do. And that is more than enough to address the common health concerns or needs that most of us have. I think one of the biggest differences between these two groups of people is that nurse practitioners cannot perform certain surgeries, but that's about it. At least from my own experience, our family doctor is a nurse practitioner, and we have had great experience with her. She is very professional. She knows her stuff, and she's very thorough every time when we have any questions or any concerns. And as mentioned before, one of the ways that your family doctor is going to support you is by prescribing medications that you need. So I do want to touch upon that a little bit because chances are the healthcare system in your home country is very different from Canada's healthcare system. So understanding how you're going to get medications, I find it's also often an important question that needs to be answered. So when it comes to getting medications in Canada, there are a few things you need to know. First of all, medications are not covered by the public healthcare plan. I know, right? Unless you are in one of the few situations, for example, if you're in hospital and you need medications, or if you are qualified for a provincial drug benefit plan, those plans are usually geared towards seniors, young children, and low-income families. If you want to find out more, I will attach the resource down in the description box. So you'll likely have to pay out of your own pocket or get the private health insurance plan. And yes, big surprise, Canada's public health plan doesn't cover everything. We'll get into that in a bit here to help you understand what is covered and what is not covered so that you're prepared. But before then, let's talk about how you usually get medications. So normally you need to see a healthcare provider so that they will prescribe you medication that you need. And in most cases, the healthcare provider would be your family doctor. But there are other options for immigrants who don't have family doctors yet. We'll get into that in a bit here. So the healthcare provider will usually send your prescription to a pharmacy in your area, or they might give you a paper copy instead so that you can bring it with you to the pharmacy. And it's also good to note that some minor issues like birth control or allergies are sometimes directly addressed by pharmacists in some provinces, which means that you don't have to go to your doctor or other healthcare providers first. You can go straight to the pharmacy to get the medications that you need. So once your medications are prescribed by your healthcare provider, you then go to the pharmacy to get your prescriptions. And usually what you need to bring is your health card and your private insurance card if you have any. And it's good to know that pharmacies often carry many different brands for the same type of medications. So especially when you're paying out of your own pocket, it doesn't hurt to ask around, compare the prices, and compare different brands. A lot of times, if you just get the generic brands, it would be a lot cheaper than getting the big company names. So because it's not covered by a public health plan, you have to pay out of your pocket unless you have private insurance plan. What usually happens is that your private insurance company is going to cover a certain percentage. So let's say if your medications are ready, you go to the pharmacy, often you only have to pay the percentage that you're responsible for after what the insurance company has paid has been deducted. Let's say if you're paying something that's $100 and your insurance company already covered 80% of it. So usually out of your pocket, you only have to pay $20 for it. I've already touched upon the provincial drug benefit programs. Like I said before, they're usually geared towards specific populations like seniors, people who are over 65, or children, or people on social assistance, or people with certain chronic illnesses. So if you or your family belong to one of these, you might check your province's website for eligibility and for how to enroll in one of these programs. And finally, here are some tips for all of us that are new here. Because chances are you have to pay something out of your pocket, so make sure you ask around and compare the prices. Ask if there is a cheaper generic version of this particular medication you're trying to get. And usually there are more than one pharmacy in your local area, so compare the prices in different pharmacies as well. And in cases where you need medications for a minor illness or a minor injury, You might not have to talk to a family doctor, especially if you don't have one. While pharmacists cannot prescribe you medications without a doctor's note, they can recommend over-the-counter medications for you. Some pharmacies offer free delivery to home and automatic refills, especially if you have to get something every month. So to save you time going to the pharmacy yourself every single time, make sure you ask the right questions. So we mentioned that prescription medications are usually not covered by the public insurance plan in most provinces. So what else is not covered? And these are often things that we have to pay out of our pocket or through the private insurance providers. So here is a list of health needs that you may have that are not covered by public health insurance. For example, dental care, we need regular dental checkups, cleanings, fillings, those things. It's not covered under the public plan. Vision care, especially if you need glasses or contact lenses, those are not covered. Prescription medications, as we've mentioned before. Medical health services, especially if you are referred to a psychiatrist or a psychologist by your family doctor, usually you have to pay for those counseling sessions yourself. Ambulance services, private hospital rooms. Let's say if you're admitted to a hospital, if you want a semi-private or a private room, you have to pay for that yourself. And if anybody in your family needs home care or long-term care, usually that's not covered under your public health plan. And last but not least, if you need out of province, out of country medical travel, usually your public health plans don't cover that. They only cover care within your province. So you might want to look at other options with your private health insurance providers. Obviously, most of these needs that we just looked at are necessary for us. So how can we get coverage for them? How can we avoid paying the full amount out of our own pocket? Usually we purchase private health insurance plans through private insurance providers, either through our employer or buy it ourselves. Obviously, different plans offer different coverage and different services, but here is a very typical coverage ratio of an employer health insurance plan that you're likely to be provided at work. So here we have for prescription drugs, usually 70% to 100% will be covered. And when it comes to dental, usually 50 to 100%. For example, my husband's insurance plan covers 80% of the dental care with no yearly maximum. So instead of paying close to $200 every time we get a cleaning, I only have to pay $40. And it will usually cover vision as well, but not by percentage, but by up to a certain amount. So for example, maybe every year you can have up to $250 coverage for your vision care or glasses or contact lenses that you need. And for therapy, usually it's covered 80 to 100%, depending on the plan, obviously. Some plans have yearly maximums, so you want to make sure that you read all the fine prints. For example, for dental care, some plans said that only cover up to $1,000 every year or $500 for any physiotherapy you might need. At the end of the day, whether you're getting your private health insurance through your employer or you're buying yourself, make sure you read through everything to know exactly what your coverage is like and what services are covered. As for the private health insurance providers, there's some common ones here in Canada that people usually go to, and I've attached their links down below in the description box. Make sure that you compare the plans and figure out which one is most suitable for you if you have to do it yourself. Okay, so at this point, we already know how the system works. We know the role of family doctors, and we know the coverage of public and private health insurance plan. Now, the reality for new immigrants is that we probably don't have a family doctor, and we're probably going to be on the wait list for a long time. So how do we get the care we need right now? So in this next part of the video, I will cover your options when you don't have a family doctor, how to access medical care if you're pregnant, and things that you need to know about emergency rooms in Canada. So if you don't have a family doctor, let's first make sure that you have indeed registered with your province to be matched with family doctors sometime in the future. And if you want more information about the registration process, refer to the links that I've attached in the description box. Without a family doctor, your next best option would be walk-in clinics. They're usually used for non-emergency care. For example, if you have cold, infections, minor injuries, or if you just need to renew your prescriptions, or if you just want to have some very basic health assessments done. So the way for you to find them is to simply Google walk-in clinics near me, and then you'll see all the clinics that are available in your local area. So the pro of this particular option is that you usually will have fast access to these clinics, but the con is that sometimes you have to wait a long time before you're able to get an appointment in, and there's no continuity, meaning that you're not going to see the same doctor or nurse practitioner every time when you go. So here I want to tell you a very interesting experience of mine. So here in Nova Scotia, there are these after hours clinics for people who don't have family doctors. So there was one time when I had this severe migraine. So I called one of these clinics and booked an appointment for a few days later. And then when I went, there was this nurse practitioner who was on duty. So I talked to her about my symptoms and things. And in our conversation, I found out that she was actually taking on patients. And that's how my husband and I found our family doctor. So my experience is a very good example of you never know when doctors or nurse practitioners are taking on new patients. So you always need to stay open-minded and make sure you ask anytime when you speak to a doctor or nurse practitioner under any kind of circumstances, just ask, hey, by the way, are you taking on any new patients? Because me and my family, we don't have family doctor yet. It never hurt to ask. Another good option is through virtual care or telehealth services, where you can schedule a consultation or request a consultation with a doctor or a nurse practitioner through these online platforms. And here are some of the popular platforms that people are using in Canada. I personally used Maple in the past. So the pro of this option is that you're more likely to get to speak to a doctor faster, and it's more convenient. A lot of times you can just open the app on your phone and book an appointment. But the con is that you have to pay for it, and some of it can be pricey, and there is a limited scope of things that the doctors or the nurse practitioners can do through the online platform. Also, keep in mind that different platforms have different hours. For example, Maple offers 24/7 service, while some other providers offer limited hours. So you really have to make sure that you are contacting them within those working hours. And some of them might be free for health card holders in some provinces. Again, you need to check out your province website and figure out what exactly is free and readily available for you. Your next option would be pharmacy clinics. In some provinces, some pharmacies offer walk-in clinics for people to come in, ask about minor illnesses, or sometimes they offer flu shots, vaccines, or they can help you monitor your blood pressure or diabetes monitoring, that sort of thing. So what you want to do again is Google pharmacy clinics plus your province, and then you'll likely find the link to the proper site. Here's just an example of what the pharmacy clinics in Nova Scotia offer. And usually on these websites, you get a direct link to book an appointment with them. Another good option for you is community health centers. The good way for you to look for them is to put in your city plus community health center, and you'll find the nearest location in your area. Some of them offer interpreters, settlement help, or social workers for newcomers. Another option that's often neglected by people is the public health units. So every province has their own public health unit that offer essential services like immunization, care, sexual health, screening for cancer or other diseases, or child development checks. So make sure you also check them out. And then we have emergency rooms. So if you have any serious or urgent issues that you want somebody to look at, emergency rooms would be where you go. Bear in mind that it's always going to be busy there, and you'll probably have to wait for a long time there. I do want to provide a little bit more detail about the emergency rooms in Canada. So that's coming up in this video. Make sure to stick around. In some provinces, there are nurse practitioner-led clinics. Usually at these clinics, the nurse practitioners there can take the place of a family doctor, so they'll be able to prescribe you medications, refer you to other specialists if needed, basically provide the primary care to those who don't have access to a family doctor. And once again, you can find them by Google nurse practitioner-led clinics plus your province, and you'll be able to find what's available in your area. And last but not least, make sure you join your community or Facebook groups, because sometimes we might even run into information about which family doctor is accepting patients. So you don't really have to freak out if you don't have a family doctor and you're not really left to your own devices. There are so many other options that are available here that can help you access that primary care that you need here in Canada while you're waiting to be matched with an actual family doctor. And next, I want to talk about a specific situation that some of us might run into, which is, what if you want to start a family? What if you want to plan your pregnancy? What if you are already pregnant? So what are the additional resources that are available here so that you can go through your pregnancy stress and worry-free? Here are some of the ways that you can get pregnancy care if that's what you need. First, you can try to find a midwife. That's usually publicly funded in most provinces, and midwives often provide full prenatal, birth, and postpartum care. And services are usually free if you have a health card in most provinces, and you don't need a family doctor to refer you to a midwife. And once again, you can just Google midwife plus your city or your province so that you can find the nearest support in your area. Many newcomers choose midwives because they offer longer visits, cultural sensitivity, continuity of care. And from what I heard, they often come to you. So you don't actually have to leave your house in order to get that care. The midwives often come to your house to visit you whenever that's necessary. Another option for you is to use prenatal clinics or obstetric triage at hospitals. Large hospitals often have prenatal assessment units, which is something that you can call the maternity department at your nearest hospital to find out. Some provinces offer prenatal clinics that you don't need referral to access. The only thing is that you might be seen by rotating nurse practitioners or doctors. So basically, whoever is on duty that day when you go in, that's who you're going to see. That shouldn't be a concern for you because most of your medical history should be all logged into the system. So whoever's seeing you that day will have access to that information. You can also take advantage of those walk-in clinics that we mentioned before, especially for your early pregnancy, if you want to confirm your pregnancy or if you want to be referred to a specialist. Last but not least, you can also track your own pregnancy. And you can do that by, first of all, keeping your own record, the important dates, the symptoms you've had, the ultrasounds you've had. And there are a lot of places that allow you to book private ultrasounds at any time that you need. And make sure you always ask the pharmacist at your local pharmacy about prenatal vitamins or other supplements that are recommended for people in your situation. Okay, before we get to the exact game plan that you need to have to get yourself prepared, I just want to talk about one more thing. The emergency room. So emergency rooms in Canada are open 24/7. Usually once you're admitted, a triage nurse will come assess you and determine the next course of action. And usually ERs would prioritize issues that need to be dealt with immediately, such as head injuries, trouble breathing, severe allergic reactions, or bleeding. So anytime when you decide to go to an ER, you must expect very busy rooms and long waiting time. And here I've done a little digging and pulled out the average waiting times at the ERs. And as you can see, depending on specific circumstances, you're likely to be in there for quite a while. We've covered a lot of information so far, and I know that's a lot of information to digest in one sitting, which is why I mapped out your action plan based on what we talked about today. So as a new immigrant, here are the things that you can start with, and they will really help you prepare for the times when you or your family needs that medical care right away. Apply for your health card right away if you have not already, and look into private insurance if there is a waiting period before you can get coverage from the public health plan. Make sure you have registered with the province to be matched with a family doctor. Look into virtual care and those telehealth platforms that we mentioned in this video and do a little bit of comparison to figure out which one suits your needs the best. Find your local pharmacies, walk-in clinics, and ERs in your area, and make sure that you bookmark those specific locations. If you're on employer healthcare plan, make sure that you read all the fine prints to understand the exact coverage and services this particular plan provides. And last but not least, join your community Facebook groups to stay informed, because you never know when anybody's going to post any information about family doctors or clinics accepting new patients. And if you're looking to move to Canada, in the near future, but you don't know which province you're going to live in, this is also a good time for you to start your research on the public health plans that different provinces offer, start to compare and contrast. And as I said before, normally access to healthcare will usually not be our top priority when we're researching about our immigration options, when we're thinking about moving to a new place, a new country. But I'm telling you, as somebody who's been here for the past 6 years, I wish this is something that I have done a long time ago because I run into countless situations in the past where I didn't know what my options were and I didn't know what was available to me. I was left completely lost and helpless. To avoid getting to these situations like I did, this would be a great time for you to start your research, get your head in the game, and get prepared for your life here in Canada. I hope this video gave you the clarity and confidence to take control of your healthcare journey here in Canada. And if you made it this far, thank you so much for your support. If you found this helpful, please like and subscribe to my channel so that my content can be pushed to more people in similar situations. And feel free to leave your questions or experiences in the comments. Let's support each other through this. Thank you for watching. Bye-bye.